Okay, so now we're going to go into the theory. So have your manual there and a pencil maybe to take notes or questions that you might have. And let's get cracking through it. Okay, so now, hopefully with that little practice and the bit at the start, you get a little bit of a sense of the movement of the joint. So just actually, I might as well go into the active range of movement. That is active range of movement, the majority of that, where we're using our strength to bring the limb up, say lifting the leg or reaching it back. So that's active range of movement. So in active range of movement, we're looking at the movement muscle, which is called the agonist. Okay, now again, this is a little bit further in the manual, but I just thought it'd be handy to put in here because we've just done the practice. So that is checking the strength of the movement muscle. When we come into passive range of movement, so passive range of movement would be where we use a prop or something to help us get into the move, and it could be somebody pushing you or something like that. What you're checking there is for more tightness in the other side of the joint, which is the antagonist. Okay, so we have the stretching joint. Don't worry, this is all in the manual. We have the stretching joint, which is the contracting joint, which is the agonist. And then on each movement, there's always opposite. And then the antagonist is the lengthening side. Okay, so with passive range of movement, the contracting side is not, I mean, it's getting a little bit of strength, but it's more the lengthening side that is being worked or stretched there. But in the world of therapeutics, that's how we check to see if a muscle is tight, is we bring it into passive range of movement. And then you have resistant range of movement, where I can push against the leg. So again, say I ask somebody to bring their leg, and we often do this. In fact, for example, that would be when we were squeezing the brick. So resisted range of movement is where we're pushing against something and it's pushing against you, is where you're checking for the strength in the agonist, so the contracting muscle. Because if there's an injury there, it will very easily become obvious when you do that resisted range of movement. Okay, so let's get cracking now with the manual. So I'm on page 2 there. I'm just going to go through the layers of learning. So the reason why I've created it this way is that I'm very aware, and certainly from myself, even though I had a real personal knowledge with anatomy, it definitely, when I was doing my 200 hours, it didn't quite sink in. And it's because you have so much other stuff to learn, but just, you know, it's very overwhelming. And I taught anatomy on 200 hours too. And from looking at their expressions, I felt, okay, there has to be an easier way of teaching this. So I came up with this learning layer, and it's to kind of give you a sense of achievement and grounding the explanation for the next layer into your head, so that you're ready to move on to the next layer. Okay, and of course, you know, you can go back through them again. So let's see, the learning layers are, your first layer is the bone structure. So we looked at, say, let's take hips as an example. You look at the bones involved in the hip, and you kind of understand, and it's really great to, obviously not everyone's going to have a little 3-dimensional one at home, but it's really good to when you are learning anatomy at some stage, particularly with muscles or with bones like the pelvis, it's just so 3-dimensional. And no matter how beautiful an illustration is, it's very hard to get your head around the 3-dimensionality of it, like these little kind of elephant ears that come down into the front here, which is the pubis, and then the ischial here at the end, which is we call our sit bones. It's very 3-dimensional, so it's good to kind of have a look at a real one. And there's also these great apps that you can get as well, where you can drag it and it will give you a 3-dimensional view, and you can layer the muscles on. They're fantastic. I don't have one that I'm using at the moment, but I have used them before. I can write into an email if you're interested in them. Okay, so once we understand the bones, again, you know, you're understanding them, but like, you don't, you know, you'll eventually memorize them. I wouldn't kind of be killing yourself memorizing every muscle name and all that. Like, just, you know, be familiar with the shape of it to start off with, okay? And then we're going to go into the movements of the joint, which we've done and we did a class about. So we've done lots of work on that. Then what I do is I teach the main muscles of that movement. Okay, so there's always ones that are kind of the more main muscles, and then there's loads of other little ones that get involved. But if you can just grasp the layer of the main muscles and what movements they do, and the general idea of the shape of the bones, you are doing fabulous. Okay, so that would be, I think, where I'm going to try and get to today is the main muscles. I might look at a few of the other muscles if I feel they're relevant, but if we could get the bones, the movement, the main muscles, we'd be doing great. And then, and then all the rest of the muscles. I have muscle charts for each of the 3 sections we're looking at today, which will be invaluable for you when you're trying to work out what muscles are working what movement. And I couldn't find them anywhere, so I created them myself from different manuals and things like that, and they're great to have. Definitely something you'll come back to all the time. Everything in the manual here is my own creation. And then the last element, which I mean, I certainly wouldn't be able to tell you exactly which, you know, spinous process the certain muscle comes from and attaches to. That's probably the layer of the learning layers that I'm still working on. Is I don't know my origins and insertions, but in terms of creating a lovely, beautiful, anatomically considered class, you just need a general. I know it's here and I know it does this. Okay, so origins and insertions, I have them all in the manual, but I wouldn't get too bogged down with them. Okay, so types of muscles. Okay, we're mainly looking, and there's going to be some things here that I'm going to breeze through because I want to get cracking through all 3 sections here. I want to make absolutely sure that that I've covered the majority of the manual. So you will go back and read through these yourself, but you've got your fibrous joint, so that's going to be your skull and your pelvis. They're the fused ones. And then you have your cartilaginous joints, which is limited movement. So we are looking at one of them, it's the vertebrae. Okay, and then we have our synovial joints, which are is going to be your shoulder and your hips. So we're going to be looking at synovial joints in depth. Okay, so the next section here is the layers of the synovial ball and socket joint. Okay, so I focused on this one because that's our hip and that's our shoulder. Okay, the spine is a little bit different, but again, I'll go into that in that section. So you've got your deepest layer is the bone. And then you've got this fibrous lining, which is called the cartilage. And what the cartilage does, it just stops the bone from degenerating. It's like, you know, kind of like a plastic seal inside the, let's talk about the hip. So it's it comes around as a C inside the socket there. And it also helps glide as well. So it's got lots of different jobs to prevent degeneration of the joint. Okay, then around the edges of the socket is the labrum, and which it's the labrum in the hip and the meniscus in the knee. So you've probably heard of the labrum because it's an area that that we can get tears in. And this is like a little triangular rim that, let's see, if you can see there, I'm pointing at just the edge of the bone there. And it's like, I suppose it's like the seal in a jar, or like, you know, or a water bottle or something. I don't know, you know, those kind of where it has that rubber seal. And because its job is to create a seal to keep the synovial fluid in. Okay, so that's what its job is. Okay, and then you've got your capsule, which is like everyone says sock, but I'd be more inclined to say leg warmers if you're around in the 80s, because it attaches to one side and it attaches to the other side. And here it attaches around here and it attaches here. You can see his hand is in the way, like a tube. Okay, and it has an inner and outer fiber. And its job is to secrete the synovial, or the synovial fluid, which lubricates the joint. So a really important job. And it's just a connective tissue, okay? It doesn't, let's see, I have that chart there. Let's see, connective tissue, cartilage, connective, no, capsule. Yeah, see, it's mainly a connective tissue. It's not supporting, it's not protecting. Its job is mainly to lubricate. Okay, now it has got sensory nerves. So parts of the joints will have neurological feedback, and that's where we feel the pain, and other parts don't have as much. Okay, so the cartilage, if you look at that chart underneath there, you'll see the cartilage doesn't have nerves. Okay, but the bones, surprisingly enough, do. That took me a while to cop on to that one. I always thought we think they're kind of a dead thing, but they do have nerves. So lots of parts of the now I have a couple of ticks there, but if you went, you'd probably be able to pull me up on it. Some of them are less than others. So some of them would be very little neurological. Something like the ligaments are high neurological. And by neurological, I mean feedback to the brain. The reason why the ligaments are so high is because their job is to prevent you from going too high into your range of movement. So it's a containment, and it's sending signals up to the brain going, you've overextended your leg there, pull it back a little bit. So it's, its job is to contain from an anatomical point of view. In other words, it's got a small amount of stretch, and it's anchoring, but also it's sending messages to the brain. Okay, ligaments. Oh, I've already gone through that. Tendons. The tendons is what attaches the muscle to the bone. So it goes bone, tendon, muscle, tendon, bone. Okay, and again, that's an area that you can get tendonitis, tendinopathies, and things like that, which I do cover in the conditions, common injuries sections. Fascia, now I could literally talk about for the entire day, so I need to be very careful not to. I've done fascia workshops because it's fascinating. It's so much more than what we thought it was. It used to be just taken off the cadavers and thrown into a bucket, but now we realize that it's this body-wide web that is full of neurological information, and it talks to and works independently of the nervous system. It is integral for injury recovery, so it feeds the fibers into injuries and things like that, and it penetrates and wraps around everything. So it's like you're wrapping, but it wraps around a muscle and it goes all the way through it too. So it's very structural, and it is incredibly strong. So you could, I can't remember what weight they put on it, but I remember seeing an experiment where they put a big heavy weight at the bottom and it didn't rip. So it's incredibly strong. There I have it there. So its job is to connect, create scaffolding, protect, repair, insulate, lubricate, distribute tension, which is a really important one. So when we talk about anatomy, to understand anatomy, we treat the muscles very separately, but they're not separate. A lot of them can be attached, and they're also all connected to each other with this fascia. Okay, so what fascia does is if there is pressure or an action to a certain muscle, it will create this tensegrity, which is like a trampoline. When you push down or you jump on a trampoline, there's a distribution of effort all the way around it, and that's what fascia does. It distributes the effort, or the insult to the surrounding areas, so that no one area is getting the intensity of the force. Okay, so let's move on to how a muscle works there. So I've talked a little bit about the origin and the insertion. So in general, it pulls the insertion towards the origin, but that rule is broken all the time. So when you think about it, if you're lying on your back and you're bringing your leg up towards your chest, you're breaking that rule. But if you're walking, that would be the natural way, where the insertion is moving up towards the origin. But again, don't get too bogged down on the origins and insertions unless you're really enjoying that part of it. Okay, and then I talked about the agonist and the antagonist. So the agonist is the contracting muscle, the antagonist is the lengthening muscle, and they kind of work with each other. If you think about it, sometimes you think your range of movement is limited by, say, this muscle being tight, but it might be limited by this muscle being weak as well. They're both kind of communicate with each other. Okay, and they're both found on the opposite side. So there's an example there. When we flex our hip, the hamstring is the antagonist to the hip flexor, which is at the front, which is the agonist. So when I bend my leg up, which this leg is doing, okay, so my hip flexors are working here to pull that leg up, particularly if they're unholding it rather than just leaving it on the ground. And then the back part of that joint has to allow stretch for this to flex. Okay, so sometimes we can't even work out what the strength of that side is if that side is tight, which the old hamstrings often can be. Okay, so you have concentric, which is where you're lifting a weight. So pretend I have something in my hand there, is where I'm lifting a weight. Eccentric is where it's actually lengthening, but because it's controlling the speed, it still is micro contracting. That's a little bit of a hard one for people to get their head around there. So this one's much more straightforward. It's contraction. But then this is eccentric, which is where we find a lot of strength work, is because it's contracting, but it's lengthening, but it's also contracting. So the slower you go with eccentric work, the more challenging it is for that muscle there. And then isometrics, if you think of plank, it's or a bakasana, or any of the ones where we're balancing, or anything. It doesn't just have to be the arms, where we're in a static position, but the muscles are all working really strongly in their static position, is isometrics. Okay, let's move on. Let's go into the hips. How are we doing for time? Cranking through the time. Okay, hips. So now I kind of have already introed to the hips. It's a ball and socket synovial joint designed for heavy use and weight bearing. Okay, and so we've got a ball shape that goes into a socket here. And now his leg is again screwed on, but you have fantastic range of movement in a ball and socket joint, which he is only going to show you a small amount of them. Okay, so they're designed to absorb force and body weight or gravity. Okay, the socket's much deeper than the shoulder joint. Okay, so it's much deeper, which makes it a little bit more stable. But the shoulder joint is shallower to give us much wider range of movement. We can even kind of stretch the arm out of the joint a little bit as well, because we use our arms so much. Now, the legs obviously are important, but we just, because it's a weight bearing, we need a certain amount of containment. Otherwise, we would be dislocating our hips a lot. Okay. So let's just go into, so let's see, tightness at the front of the hips pulls the pelvis forward into anterior tilt, causing the lower back to overarch. Okay, I'm just going to demo that from kneeling because my head might get chopped off. So tightness in, where have I gone with the front of the hips? So if you think about it, if you have someone that's sitting all day and the front of their hips gotten tight, so this is happening from a standing position. So because they're trying to work out center of gravity as they're walking, the upper back has to compensate to come more upright, and we end up with an overarch in our lower back there. Whereas if the opposite happens and we are tilting our pelvis, so if we've tightness in the back of our hips, so that's anterior tilt, anterior, and this is posterior tilt, where it's tilting backwards to the posterior. If you have someone who's a chronic glute clencher, which I'm inclined to be, the pelvis will tilt back, but then what happens to our lovely arch in our lower back? It gets flattened. And eventually over time, the force of gravity will be pushing down on those vertebrae, and they end up with lumbar issues and degeneration in the lower back. That's what our lovely arches are for, which we'll get to in the spine section. Okay, So I think that's probably hips perfectly stacked. Yes, you can read the rest of that in your own time there. That's the main points from that. So then you've got the bone structure of the hips, okay? So you have the pelvis, which is a combination of fused muscles there. And we've got the leg bone, the femur, okay? And the ball, this section here, if you can see it, I'll bring my little skeleton a little closer. This section up here that's sitting inside the socket is called the acetabulum, okay? Okay, and then you can have a look. There's lots of bony landmarks there on those two pictures that if you have that open, if you are going to look at the origin and insertions on things, that's where you'll kind of get familiar with those names. One that would be handy to know is the ASIS. So that's the front here, the pointy hip bone. We just call them our hip bones. Our pointy hip bones, okay? So they're a great landmark when you're getting students to be aware of where their pelvis is in space. Okay, and then we've got, as I showed you there, you've got the front there, which is the pubis, and then the ischium at the back there, which is the attachment for the hamstring, which can also cause yoga bum, if you've ever heard of that, where that attachment can get aggravated. Okay. Great, we're making good progress now. So we've gone through the ranges of movement there. Okay, now let's go into the muscles. Now the common hip injuries, I am going to let you go through in your own time. The only one I would kind of mention is get your head around tendinosis and tendinitis, okay? Because a lot of people come in with that. And so tendinitis is the inflammation, whereas tendinosis is where the inflammation has kind of become chronic and they haven't left enough recovery time. So it just becomes a more chronic injury that lasts for longer, which is, for example, I did that with my hamstrings. Where in yoga you can certainly overstretch the hamstrings and then you just keep practicing, and just when I had it at the stage where it was gone, I'd go, this is when I was much younger and didn't have a clue what I was doing, I would go into a deep stretch again and I'd be back to square one. So I went from a tendinitis injury to a tendinosis injury, which took me about 5 years to recover from. So worth mentioning. Okay, now I would read through them. It's not your job, unless you are a physiotherapist, it's not your job to diagnose any of these, but I would be aware of them. And in reading them, don't let that make you feel that it's your job to understand how to correct them. It's your students' jobs to know, working with their physiotherapist, what their ranges of movement need to be within your class, okay? But it is kind of, I do think it's kind of polite to be aware of them so that you can, kind of go, oh yes, I know that, and what has your physio said, or have you been to a physio? And kind of, if you know adjustments, great, but if you don't, you're not their physio. Okay, so you have your chart there on the previous page, but I think it would be more that's again just to have them all in one place. We will go into each one separately now, okay? So hip flexors. So that is the movement of the leg coming forward, okay? Flexion. Your iliopsoas, which is made up of two muscles, the iliacus and the psoas, and you'll see them there in the picture. So obviously on my diagrams there, the muscles that we're talking about are the ones in blue, and then when you get to shoulder, you have two types. So I've got green and blue. Okay, so you've got your iliopsoas, which job is flexion. But then, so you also will have a primary job of the muscle, and then it'll do a little, like I was saying, they're not all just so clear cut, and this does this, and this does this. And, so when you move your leg forward enough, the iliopsoas is working, but lots of other muscles are working. It's not so clean cut, but to make it easier, let's pretend it is as simple as that. It also does a little bit of lateral flexion. If you think about it, it's a two-sided kind of joint. So if something is just happening on one side, it will create, with most of the time, lateral flexion. Okay. Now, again, I'm not going to go into an origin insertion. You've got your tensor fascia latae there. Let's just go through them. But again, I want you to focus mainly on the ones in the yellow box as being the ones that you kind of understand more. Tensor fascia latae is the pocket one. It's a nice one to roll with your myofascial balls. And it has quite a lot of different jobs. So you'll notice when you're going through this that muscles will be repeated. And that's obviously the muscles that have multiple jobs. So for example, if you go on to the next page into hip abduction, there is the tensor fascia latae again. Sartorius and tensor fascia latae, there's quite a few, particularly hip muscles, I think, or maybe all of them, that have multiple jobs. And so I wouldn't quite say that flexion is mainly the tensor fascia latae's job. It's kind of just a little bit of everything. Okay. Let's move on to the poses that stretch and strengthen the hip flexors there. So lunges, like we went through, a warrior one, a bridge pose that we went through as well in our practice. If you think of Ustrasana, oh, sorry, these are stretching, yeah, that stretches. So it's the back leg and lunge there. That's, and the back leg and warrior one. Yeah, sorry, I was thinking of strengthening. And then I got to Ustrasana, I was thinking, oh my God, why do I have that there? So Ustrasana is camel pose. So you can think the front of the hip stretching, Dhanurasana, and Natarajasana is dancer's pose. So if you have my cards, you can go through, or even one of my posters. If you're not familiar with the names of these, you can or Google them. And then if needs be, and it would help you, you could draw little stick people of the poses there so that you know what I'm talking about if you're not familiar with the names. And the poses that strengthen the front of the hips, chair pose, which we did, Utkatasana, and Navasana. So this would be the one where I have the legs, so I'm lying on my side and I'm lifting both legs up, so that's Navasana. And Uttanasana, forward bend. And Paschimottanasana is a seated forward bend. Utthita Hasta, so the standing where I'm lifting my leg up. And warrior one would be the front leg. Warrior two would be the front leg, and warrior three would be the standing leg. Okay. So hip extensors is going to be, how am I doing for time? Dangerously tight. So gluteus maximus, I might not go through all the poses within each group. We'll just maybe look at one or two of them because I do not want to get caught on time here. So gluteus maximus there is one of your main extensors, and your hamstrings. And the hamstrings is the name for a collection of three muscles which you have all there in your chart, colored in blue. Okay, and then you've got an additional one of the quadratus lumborum. So poses would be, let's see, you've got, so the extension, so you're stretching in a Panasana. That is, gosh, that's even, isn't that child's pose, I think, isn't it? Yeah, it is. And happy baby, pigeon, Paschimottanasana. So in my theory of agonist antagonist, it's almost can sometimes be the reverse of the other side of the joint. So hip flexors, the ones that are stretching the front of the hips, are going to be often strengthening the back of the hips, as long as you don't have a prop involved. Okay, figure 4, Farlog, lizard. And then let's go on to the poses that strengthen the extensors would be bridge pose, which we did, and lunges, which we did, Shalabhasana, which again is a great one for the spine extensors as well. Okay, so just a few through it, and let's move on to our hip abductors. Okay, so you've got your gluteus medius, which I keep going on about, and then deep underneath that is the gluteus minimus. Okay, so they're your two main hip abductors, but they are also, I put an NB beside them, a little asterisk. They are so important for hip stability. So fantastic muscles to work on with your students. Okay, and then we've got muscles or poses that stretch those muscles would be Gomukhasana. and Ardha Matsyendrasana. So ones that are going to be kind of bringing the leg over the midline. And then poses that strengthen. I don't have it written down there. So if you have a pencil, I certainly would put lunge in, because it's that idea of like I'm hugging in towards the midline. So lots of poses that are balancing poses would be working those, the gluteus medius. Okay. And I hope you're still with me now, because I'm going to have to go through these kind of at a fair old pace, but I want to get through them all with you. So hip adductors, okay, so you've got a group of adductors, longus, brevis, and magnus. There's also a minimus one, but I didn't put that one in. And then you've got your gracilis and your pectineus, but then we've just focused on the adductors as being the main ones in the yellow box there. Okay, so now in our class today, we worked them with the brick. So we did chair pose and we squeezed the brick to strengthen our adductors. And then to stretch them, we would go into, which I don't have down there actually, but a stretch would be like goddess pose, the legs wide, which we did. Remember, we came up and down from goddess. That's going to have a little stretch in the adductors there. And poses that strengthen them is Vasisthasana, warrior two, poses that we are kind of hugging the legs in towards the midline. And Garudasana and Gomukhasana, again, those ones where you have the leg over, and think of Gomukhasana as well, where you're standing and you're squeezing the inner thighs together. Let's look at internal and external rotation kind of together. Internal rotation is one of those funny ones actually, and it's when I was looking through all the anatomy books, and there's, you know, it's a real example of like a collection of muscles do the job. I have tensor fasciae latae highlighted as the main one, but I certainly wouldn't really call it the main one. I think it's just the one that seemed to be overlapping in a lot of my anatomy books, because there's lots of different ones that it's kind of, you know, they have a main job and they also do a little bit of internal rotation as well. Okay, and then external rotation is the piriformis. Again, a great one to work on with the MF4 balls. It can get cranky, and the go-go cue, you have them all individually there. You can learn off the individual names, but go-go cue is perfect. That's your external rotators there. And poses that stretch would be pigeon and figure 4 and farlog, and poses that strengthen are going to be warrior 2, because we saw that the leg was externally rotated. And then any of those family of poses like Trigonasana, Parasakkanasana, any of those poses where that leg is still in that rotation there. So that's, I know my head is chopped off, so it's still in, showing very bad alignment there. It's still in that rotation. So there's a family of poses, and even Ardha Chandrasana, because the leg and the hip are still doing that, except you've lifted the leg up. Okay, and Vrikshasana, external rotation. Okay. Yep, great. Into the shoulders now. Excellent. So the shoulders, as I mentioned, are also a ball and socket synovial joint, but much shallower to allow for lots more movement. Okay. So the tightness, as we did with the other one, tightness at the front of the shoulders will cause the lower back to flatten as well. So if you think about it, and my shoulders are tight here, get this out of the way. My shoulders are tight here. The same thing is going to happen. My pelvis is tilting back. My lower back is flattened, and then my shoulders are rolling forward. Of course, I'm exaggerating there, but we often spend, if you think about it, and you're working at your computer for the day, I often get an awful fright when you've noticed you're really concentrating and your shoulders are really rolled forward, and it has a knock-on effect all the way down the spine and into the hips. And then tightness on the back of the shoulders, a lot less common, even with, you know, weightlifting bodybuilders. It's more about they're overworking their pecs and they're rolling everything forward. So a lot less common, but it would lead to kind of the head jutting. And again, the opposite happening in the pelvis would be tilting forward, and I have an overarch in my lower back there. Okay, much more complex joint. We're going to break it down into the shoulder movement and then the scapula movement, okay? And there is our bones there, okay? You've got your shoulder blade, which is the scapula, and the arm bone, which is the humerus. And then you also have the clavicle, okay, which is a lovely one to palpate across the front of your upper chest there. And the ball and the head of the humerus sits inside the socket, and the socket is actually just the side of the scapula. Okay, so it's made with just the side of the scapula there, and so that's how shallow it is. It's actually the joint is the socket is just at the side of the scapula there, and it's called the glenoid fossa. Okay, so then you've got your different joints there. Your glenohumeral joint, which is this one, humerus, glenoid fossa, that creates that joint. We then have the scapula is another bone that's really good to look at on an actual skeleton, because it's another really very three-dimensional one. We've got these kind of, yes, this is really easy to understand, the kind of triangle shape of the scapula, but then you have these two bony protrusions, one of them which here that creates a joint with the clavicle. It's called the acromion and the clavicle, so it's the acromioclavicular joint. Big long word, don't worry about the names of these things. And it's a gliding joint. And then we also have a joint here at the other end of the clavicle and the sternum. So there's your sternum plate there. And that one is called the sternoclavicular joint, okay? So the ones that we're mainly going to look at today is the glenohumeral joint, but that on its relationship to the movements of the scapula. Okay, we've gone through the movements, but we haven't gone through the movements of the scapula, okay? So we have elevation, where the scapula moves up. We have depression, where the scapula moves down. Then we have retraction, where the scapula, and it might be moving on both sides, moves towards the spine, and protraction, where the scapula moves away from the spine. Now, whilst we can kind of, I can show you this from just a seated position. So we've got elevation, depression, and then retraction and protraction, where it is mainly, important to look at it is in movement, okay? So you look at it in movement. When my arms are flexing, it's coming up. And then when it's moving back, it's coming down, and out to the side, it's rolling out. Okay, so like when I explained at the start, the shoulder is more complicated to get your head around, because the socket is not stationary. The socket is also moving, because remember, the socket is on the side of the scapula. So the socket is moving to facilitate greater movement, which means that there's muscles involved in allowing that to move. So it means the arm bone is moving and the scapula is moving, which gives you two different groups of muscles to create this movement, which makes it more complicated. But you'll get there. Okay, so where the scapula is lifting up, we've gone through the movements of the scapula. Okay, and then you've got a great illustration on page 12 there, where the movements, it shows you all the different movements. Okay, now, I know we didn't go through the chart on the other one. Let's see, which would be simpler to do it this way, scapula movement. No, I'll do it individually, because it actually gives you what happens to scapula when you go into each muscle movement. Let's quickly have a look at the rotator cuff. So where I talked about the gluteus medius as being the kind of main stabilizer of the hips, the rotator cuff, often referred to as the sits, it's just an acronym for the 4 different muscles, is the kind of stabilizer for this joint, the glenohumeral joint. So kind of like the well, it doesn't seal all the way around, but the same principle as the capsule that I talked about before. It does surround the the majority of the circle of the ball and socket attaching to one side and then attaching to the other. Now it's kind of circles just around kind of the outside of the top, the head of the humerus, but it doesn't just circle around the inside of the socket there. That would just make it too easy. It actually attaches further into different parts of the scapula. So usually the medial edge, and then one of them is on the inside of it as well. Okay, so what are the different ones? So in the order of learning the acronym SITS, I have, is the way I learned it anyway. So it is the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Now, what I would say about the rotator cuff is that their main job is to stabilize the socket because it's such a shallow joint. But each muscle does have movement capacity, but they might not always be well, certainly with movements like this, they're not the main mover of the joint. With something like external rotation, probably are the main mover of the joint. But let's go through them with each muscle. So you have supraspinatus assists in abduction, okay? And then infraspinatus assists with external rotation, and so does teres minor. Okay, so those two kind of go together. They're quite very similar rotation. Teres minor is just smaller. You can see it there, it's underneath. And then subscapularis is the one that's on this side, the inside. You can see where my finger is pointing, the inside of the scapula there. That's the one that's internally rotating. Okay. So subscapularis, now if you are interested in helping people with the rolled shoulders, that can sometimes be a hidden cause along with the pecs and the lats of that internal rotation in people that do a lot of weight training to the front of their body and end up with the kind of the monkey arms. Okay, so that is your rotator cuff. And then let's go into the main muscles of the scapula. Okay, so you've got your rhomboids and your serratus anterior. Serratus anterior is like these fingers that come from the different parts of the vertebrae and attach to the inside medial. So medial is inner, lateral is outer. So the inner inside. So I can't get my finger into it, but the inside part of this here on the inside. And then the rhomboids attach to the outsides of either side. So they're the ones that pull they retract the scapula. Rhomboids retract. Serratus anterior, if you can imagine the little arms inside there, pull them apart. Serratus anterior are a really important one for preventing the scapula from winging. If you ever look at your students who are in plank pose or any kind of arm bearing poses, and they might have either one or both of their scapula winging off their back there, that is their serratus anterior is not pulling their scapula onto their back there. So you can tell them maybe to push their hands into the ground and roll their shoulders backwards to try and get that scapula to work there. Okay. So, and then now I won't go into the others. The trapezius, have a look at them yourself there. They're a bit more complicated because there's upper, mid, and lower, and then two of them working together create upward rotation there. Like upper and lower trapezius creates that upward rotation of the scapula, which would be this. So upward rotation is this rolling up, okay? Downward rotation is it rolling downwards. So another thing that used to cause a lot of confusion is the upward and downward rotation. So if you think of the name of the movement coming from the outer corner of the scapula, that will help you, okay? So upward rotation, what's that corner doing? It's rotating up. Downward rotation, what's that corner doing? It's rolling down. Okay, hope that helps. Okay, let's move Okay, shoulder flexors. Ooh. Okay, so we've got your pectoralis major and your anterior deltoids. Now your deltoids you can kind of divide them into three. So you're going to see them repeated. Your deltoids are the ones that bring the arm mainly out to the side, but they also have a front section and a back section with assist with flexion and extension, okay? And then now, I'm not going to go through the poses because let's just do one. So let's say plank, the obvious flexion there, okay? And then that is, plank is strengthening, and stretching would be Natarajasana, where I'm holding the back foot there, or anything where the arms are stretched into extension. That means the front of the body is being stretched. Okay, and then the shoulder extensors are the lats, okay? Big muscle, such a small little attachment. They're like big muscle on the back, your back there, and it attaches to the inside of the upper arm there. They're strong muscles, and they are responsible for extension. But again, remember that principle of, if my arm is up here, all of this is working my lats, okay? Not just from anatomical position. And that just opens up a wide field of possibilities if you're trying to strengthen a particular muscle or work on a particular muscle. Okay, and then the posterior deltoids, like I mentioned before, the deltoids mainly is to abduct the arm, but they do have a front and a back that do a little bit of assisting. Okay, muscle that stretch will be Ashta Chandrasana. And then muscle that strengthen would be Purvattanasana. Purvattanasana would be where you're on your back, or you're that one with the legs are forward, and I'm leaning my weight on my back there. Not my back. I'm lifting up in the arms. Okay, let's move on to now in those two, I have the movements. If you could go through them in yourself, what the actual scapula is doing there, and you will find in the diagram, it's the green shaded muscle is what is moving the scapula, and the blue shaded muscle is what is moving the humerus. Okay, I did say it was a complicated joint. Okay, so abduction, we've talked about the mid-deltoid here. Okay, you can see it there in the picture. It sits here. And the supraspinatus, so one of the sits. And as I mentioned before, it's not its main job, but it will bring it to a certain degree. I think it brings it up to almost kind of 45, and then the delts take over. Okay, so it initiates movement. Okay, warrior two is the most obvious one for abduction, okay? And then Vasisthasana on the side would be abduction as well. But that strengthening and stretching would be these ones, okay? And then adduction. So for adduction, you've got the lats. So again, with this one, it's not its main job. So I have its main job first there. It's kind of its secondary job. So you think about adductors is the lats, but its main job is extension, and the pecs, but its main job is flexion. But it still is keeping the arm in towards midline. Okay. And then to stretch would be warrior two, because I'm stretching. And then to strengthen would be these ones again. Okay. And then internal and external rotation. Now, I'll quickly go through external rotation, but internal rotation is an important one, because these are the two that are frequently over strengthened, which creates this internal rotation and affects your posture. So they're ones that great to strengthen them, but make sure that you're strengthening the opposite side of them too, which would be the external rotators, which are the ones that often get ignored. So you're trying to get a little bit of external rotation to the arm if you have someone that's too tight or working too much in the pecs and the lats because they are internally rotating the arms. Okay, so that's the lats and the pecs at the front there, which are rolling the arms in. And then you've got your infraspinatus and your teres minor, which are, can you remember, part of your rotator cuff, and they're the ones that are rolling the arms out. Okay. So let's move on then to the spine. Okay. Okay, so spine is a synovial joint, but instead of it being a ball and socket, it's a gliding joint. So there's two bones that glide against each other. But with the spine, you've got three connection points. Okay, you've got the body of the vertebrae, and then you have two joints called the facet joints, one on either side. So there's three weight-bearing parts on a joint. Okay. So we have, obviously, it holds us up against gravity, and it houses and protects the spinal cord. And it also, this part, so the thoracic part of the spine is really important because on each vertebrae is attached to each vertebrae is a rib, which protects all, or not all, but a lot of the upper body organs, which makes the thoracic area much more stable when we're looking at it. So if you think of your students' injuries, quite a lot of them can be in the cervical spine and the lumbar, because they're considered to be more free floating. They have a lot more movement in them, which makes them prone to injury. But as I mentioned before, the lumbar doesn't have much rotation, but it certainly has quite good flexion and extension. Okay, so between each vertebrae is a disc, which is filled with a jelly-like substance, which when it ruptures can cause injury. So that's a disc herniation, okay? So one important thing to note on the old disc issue thing, well, two things to note, is one, that people talk about a slipped disc, but it's physically impossible for that. We call it a disc, but it's not like a jelly bean or something disc shape. It doesn't slip out. It is firmly attached. It's more like, again, the sock structure that I talked about for the capsule. It's attached to the one above and the one below firmly. So what happens is one of the sides can bulge, but the whole thing cannot move out. So slip disc is the wrong language. That leads people to feel like there's this jelly thing has slipped out the side of their vertebrae. So a bit of re-education on that with your students might help them feel less vulnerable if they have got a slip disc. The other thing is that, slip disc, herniated disc, or they say they have a slip disc. A disc herniation, sometimes if you have a student that comes into you and says, oh yeah, I've had a disc herniation, and you kind of might say to them, hey, when did that happen? And they'll go, oh, 10 years ago. That's not an injury anymore, unless they have not healed properly, or it reseals. Okay, it's not just leaking jelly out, it reseals. Now what might happen is that it might not have quite as much sponge to it, but people get very attached to their injuries that have happened a very long time ago. You could have someone who's had a herniated disc that feels absolutely no effect of it because it's healed, whereas other people can carry it a little bit longer because they might have pain patterns that are stuck, or they might not have strengthened the spine sufficiently to clear the injury completely. Okay, and then let's see, where are we? It bulges out to the side and pushes into the nerves. Okay. Most vulnerable parts of the spine is where we transition. Okay. So where it goes from cervical to lumbar, from cervical to thoracic, from thoracic to lumbar is one of the biggies. And then from lumbar to our sacrum there. Okay. So the juncture points. And I know, like, we've just named things, but these are natural points where the curve changes direction and the forces of gravity is a little bit stronger in that area. So that's the areas that are more prone to injury. And then I talked about the free floating areas there. Okay, and then just having a look at the structure of the spine there, you've got 7. So the way I was taught this, it's a little bit, it depends on what time you eat, but like, you think of, you have your breakfast at 7, you have your lunch at 12, and your dinner at 5. It's a bit fudgy, but that's the way I was taught how to remember the number of different vertebrae that make up the 24. Okay, moving on. I've gone through the movements of the spine. Oh my God, I don't think I pressed record. I'll have to deal with that later. You are very privileged, you 3. Okay, so the movements of the spine are, we've gone through that, okay? Sorry, I'm reeling here. I'm gonna have to sit down and go through all this again. Okay, and then I've talked a little bit about disc herniation there, okay? I am recording, thanks be to God. Okay, I've talked a bit about disc herniation and bulging. Right, back on track. Mini heart attack there. Let's start going through the muscles now of the spine. Okay, the hip flexors. Now, a lot of the hip flexors. Now, I did talk. Read through that yourself, where I talk about the core. Okay, because the core is an important component of both the spine, and you will notice some of those muscles are also related to the hip section too. Okay, so yeah, the core is often misrepresented as just the front of the body, but when you're talking about the core, you have to get into the habit of talking about it being a full wrap. Okay, remember I talked about the transverse abdominis, which is the one that kind of holds us up against gravity. It's not one that facilitates movement, but it's a really important one for lumbar strength, or just lumbar stability. Okay, so hip flexors, or not hip flexors, spine flexors are the ones that we would traditionally think of as being the core. So you've got your rectus abdominis and your internal and external obliques. So the internal ones go up this direction, origin insertion, and the external come that direction. Okay, so internal and external obliques, they have lots of jobs. So they twist us, they laterally flex us, and they flex us forward too. Again, ones that are, there's all sorts of, like when this one is contracting, this one's lengthening, and that brings you into a twist. I wrote an extensive article a few times, I think, on my website about that. So if you're curious to learn more about the way the obliques work, go into one of my, I can link to it maybe into the bits underneath the YouTube. Okay, and then you've got your poses that stretch would be, again, Ustrasana, camel pose, and poses that strengthen is, now I have written Bakasana there, but there's loads of ways that you can, there's this fictitious thing that yoga doesn't use the core. It absolutely does. And there's loads of ways to get the core into your yoga practice and to your classes. You just have to work out where those muscles are. And, again, often working against gravity will help you to get to the muscles, because we don't have the benefits of weights to be able to get to. Okay, so the spinal extensors then, this is where I said the hips are straightforward, shoulders are complicated, and hips are spine. There's quite a lot of muscles, and there is more, but I didn't want to overwhelm you. So let's just stick with the main ones. So the erectors, like the hamstrings, there is a collection of muscles, but if you just refer to them as the erectors, as the name suggests, they're the ones that keep us upright against gravity. Now, there's a kind of a little bit of a up for debate as to whether, some schools would say that the erectors don't really need to be strengthened because they're constantly working to keep us up against gravity. I feel they do need to be strengthened in order to help us from caving against gravity. But there's loads of ways we can strengthen our erectors in our practice there. So let's see, we'll have a look at some of the poses there. I would also say, like this, it does not stop at what I have given you as the poses there. So if you start to play around with poses yourself, what I would say is if you pause in them long enough and you start to feel what's getting shaky or what's fatiguing, that's the area you're working. So for the extensors, one of the best ways is Shalabhasana, but you can do lots of different types of Shalabhasana. You can also add that lift, like I was showing you in Warrior, where I'm not just focusing on what's happening in the hips. I'm trying to get them to reach the arms back and lift the chest up, to shine the front of the chest forward in order to strengthen the back a little bit when I bring them into Warrior, rather than just having them looking down at the ground. There's loads of different ways that you can get into the different areas. Okay, and then let's go into the rotators then. So as I mentioned, the internal and the external obliques, which you can have another look at in some of my articles, would be the rotators. But then you also have this bigger family of muscles that run up and down the spine, all along the spine, called the rotators and the multifidus. Okay, and they so they wouldn't be the main movers, because if you actually looked at the anatomy of them, they're tiny. So they might be just attaching to one spinous process to the transverse process of the next one. So that's not going to bring you into massive rotation, but it certainly is bringing your spine into the kind of spiral staircase all the way up through the spine. So they're certainly important for the stability of the spine within a rotation. Okay, spinal lateral flexion there. So again, we talked about the quadratus lumborum, or QL, and it's lateral flexion, but we have also encountered it before in extension, haven't we? So because it's one on each, or there's one on each side. So if you just contract one, you're going to be bringing yourself into lateral. And of course, what's happening the other side? It's stretching. Okay, agonist, antagonist. And then you have the internal and the external obliques there as well. Woohoo! Okay, we've made it through all the muscles there, and it is exactly 12 o'clock. So I will give you just, I think it's important to go through, give me the thumbs up there if you want. If you're completely wrecked, I can go straight to the Q&A, or would you like me just to talk a few minutes about how to apply this to your practice? Okay, I think that was 3 thumbs up, so I'll just do a quick one, okay? And now this is something that I go into in huge depth in. I did another training there about 2 months ago. Basically, each month I'm going to alternate trainings called Smart Sequencing, where I go into this in depth. I mean, you also find lots of articles on my website about sequencing, but this just will give you the very bones, pardon the pun, of how I build sequences. Okay, so you've got your body themes. I always theme, obviously, you can tell from my website. You've your body themes, your mind theme, and your spirit themes. So obviously we're in anatomy, so we're going to look at body, and we're going to look at a peak pose. If you're quite new to sequencing, I really recommend working with the peak pose method to get you used to it, because it's a really great way for you to start learning what's happening anatomically in the pose, because you're going to just look at the static pose and you're going to be going, what's the hip doing? What are the shoulders doing? What's the spine doing? And then you go, what other poses do that? You know, and even if you haven't quite got used to the feeling of the movement, you just look at the pictures of the poses, and if the leg is in the same position. So for example, I have picked Warrior 2 as my peak pose here for abduction, and get your pencil there and write a B instead of a D there on those 2 sequences I've given you. It should be strengthen hip, abductors, okay? That will confuse the hell out of you. I've written adductors, so it's abductors is the sequence. So I picked warrior 2, but if you look at, you know, when you start to build a picture of what else, what other poses do that I can incorporate into my sequence, so that by the time I get to my peak pose, my student's body is ready to accept that pose. Now that's just, you know, your peak pose might be much simpler and it might be much earlier in the class, but then you look at it in different ways. So say your pose is Shalabhasana. It might be reasonably early on, but then you can keep coming into it and adding complexities to it to make it more challenging for them. Okay, so the first step then is to brainstorm, like I talked, is you look at the pose and you look to see what each part of the body is doing. And then you pick lots of poses that are doing that. You pick up warm-up poses and cool-down poses that, so the warm-up ones are going to be bringing it in that direction. The cool-down poses might be stretching the opposite direction, but sometimes a cool-down pose can be a seated pose. If you've done like a big class about the hip flexors strengthening, a cool down pose might be Paschimottanasana, so seated forward bend, because it's a really hard pose to take unless you're well warmed up. So it might be a lovely opportunity to have that in your cool down section. Okay, and then once you've kind of done this, I love to see post-it notes, scribble pictures, like, you know, I definitely would encourage you to get your head around stick people. I just don't know how people write the names down. It's just I'm a visual person, but it's just so much easier to get used to drawing the pictures. You just draw a few of them and then you can move them around, practice it and see how it feels. Okay, so you've got your hip abductor theme. I've picked the hip abductors, glute medius and minimus. I'm strengthening them. My peak pose is warrior. And then I go through what needs to be stretched, what needs to be strengthened within that pose, what are the actions of the pose. You know, it's a standing family. The outer hip is being strengthened. My legs are getting a workout too. What other poses have similar actions? What is the energy of the pose? And what other poses have similar energies? So that's where you can add in. It's good to look at it from what anatomically is working, but also what is the energy of the pose. Otherwise, you might end up with a class where you're feeling quite stifled about, well, the arm isn't doing the same thing in that pose as it is in my peak pose, so it's not relevant. But it might be if it's got the same energy that you're trying to create in the pose. Okay. My God, I hope you're not absolutely drowning in my voice and everything I've thrown at you. So I am going to switch off the recording and then we'll go into Q&A. So for the people doing just the recording, very happy for you to, I'm not going to put the Q&A up. I want it to be just personal for the people here to talk freely. So you're very welcome to email me questions, and indeed anyone here who's live and you need to have a little think about something and come back with questions. I'm very open to questions. Thank you for joining me and I hope to see you again soon.